I'm happy I has chance to representative the Professor Liu to give the report about this summarize about how using the traditional Chinese medicine involved in the SARS treatment. So I'm feeling shame he hasn't come here by himself, but I'm very happy to talking about this experience because some of doctor was my colleague and come from same university, and also the SARS department, the treatment that the SARS department is used to be I working for. So this is where all of my colleagues to fighting with the SARS. So this is where today in the international conference, I have them to just summarize this successful. So in China, the system slightly different than the Western. In China, the TCM also in the mainstream. So this is where our TCM has a hospital and also university in China. So this is where the SARS suddenly exploded in the 2003. 2003 initially they happened in the Hong Kong. So they just found some case. It's quickly to happen the very bad breathless, fatigue and the fever. And nobody knows this what kind of the disease and don't know how to treat it. So this is where they just notice this kind of patients. Its transmission so quick. Many staff, doctor, nurse be involved in the condition. So this is where initially the two cases is moving from Hong Kong to Beijing is accidentally to in the traditional Chinese medicine hospital. So this is where in my hospital, the one patient be acceptable in our A&E, one doctor, one nurse, and one consultant's wife be involved in this condition, died. Then the patients acceptable to the hospital, moving to the ward, transfer for 36 patients. So this is where initially nobody know what happened. So this is where that time, because in the TCM hospital, so this is where we suddenly using the conventional treatment and TCM. So this is where the Professor Liu is making summarize for this procedure. So this is where in Beijing, during the SARS rescue, later they push all the patients in one hospital, surrounding them together, and all particularly the staff to service for these patients. Oh, sorry. Put this one. So this is after the SARS to treated, then the state academy of traditional Chinese medicine science, they making the research. Later, this research beget the second, the excellent award, research award. So this is where in the 90, after the SARS, the same year, 2003, the 8th of October, the 8th of October, the WHO to evaluate the whole rescue and the treating condition. All of the experts of WHO to grave integrated TCM, the effected for this pandemic disease is safe and with the potential benefit. So this is where, and also the treating cost of TCM is much less than the routine conventional medicine treatment. So from this report, the Professor Liu is summarized from this rescue procedure, which kind of the experience. So this is where from the TCM, they found the 10 experience. You know, roughly from this rescue in Hong Kong, the latest report, the patients, the mortality, 30%, and Beijing is 6%. Guangzhou is 3%. Where in also in the TCM involved the treatment, the Beijing is still high than Hong Kong because Hong Kong is TCM involved in the first time. Beijing only Beijing University of TCM hospital using the TCM. Rest of hospitals still retain the conventional medicine treatment. About a couple of weeks later, the government found this experience. Then they making the expert group to join the treatment from the TCM. So this is where the Guangzhou is much lower, the patients, the mortality. So the experience is, number one, is also for this pandemic disease, the traditional medicine also should be involved treatment as soon as possible. Then they also notice TCM has TCM diagnostic methods we are differentiation of syndrome. Differentiation of syndrome means give the patients evaluate for your body's constitution. So this is where involve this kind of the treatment. We're using the herbal medicine to balance the body, then may making the patients good reaction with conventional medicine treatment. So this, for the SARS treatment, the SARS patients, the mainly condition is a high temperature. The conventional medicine have to using the high dose of steroids. But the herbal medicine, in China, because we are we are mainstream, so this is why we also can using the herb medicine injection and infusion. So this is because SARS patients always comment. So this is where the oral taking is probably is not that good enough. So this is where this is a third experience is the if the traditional medicine be involved as earlier, the final result is much better. And also, the TCM, the diagnostic methods, such as we have the tongue diagnosis, we have post-diagnosis. They also objective and easy to have. So this is where for the monitor patients, the condition, and to summarize the result, also can using the traditional Chinese medicine's diagnostic methods. So this is where the you can see this is tables. They said the antivirus, antibiotic, and the immune system treatment. So you can see all of treatment is routine treatment because someone always said, oh, why are you using the herb medicine only? But you understand, that's so severe case in the hospital. Also in China's hospitals, still conventional medicine in authority. So this is where how to say patients avoid conventional medicine. So this is where the research group probably is integrated medicine and Western medicine only. So this is where you can say the first group, they said how using the antivirus treatment. You can say antivirus treatment, the group using the antivirus treatment is much less, the dose. And the antibiotic also is the integrated medicine group using the dose is less, and using the time also is less. And also you can see this one is how the central figures of patients using the steroid dose. If using the herb medicine to control the balance, then if using the steroids can be using lower dose and last short time. We noticed later on, for people using the steroids, high-dose steroids for a long time, most people be sure the osteoporosis. So these were some of the patients is living with the Western medicine group. They need treatment for the rest of their life, living very severe osteoporosis. But Chinese medicine group don't have that side effect because they're using the steroids with a short dose and with a short time. That is for the temperatures reduce. Temperature reduce, the TCM's group and the conventional is the same. So for TCM ourselves, also they summarize some experience because we can manage the herbal medicine such as band the pathogenic factor, because virus or inflammation, we always call that is pathogenic factors. So this is where for the TCM, we also summarize in our technique how to manage them. So some doctor is taking very experience, such as TCM, we always said using herb is guiding the pathogenic factor is going with the right way, such as like your pathogenic factor going from stool or going from urine. So we always know how to manage the herb, let them quickly to going out, quickly to be released. So they summarize by TCM themselves. And also the experience, this time where the TCM treatment is be positively evaluated by the WHO and observed by the whole scientific areas, because they said using research with the standard methods. So this is where we all said making our traditional Chinese medicine acceptable by the international research group, we must be making our familiar and know how to do the research in the standard methods. So this was since the SARS treatment, we said we also have confidence with our traditional medicine. So this is where the China's State Academy of the Chinese Medicine, they said how to do them in the future. You can say recently China gave a lot of funding to support the TCM the research. For the severe chronic infective disease, they gave the 1 billion for 15 years. And for the disease with suddenly broken, that disease research gave the 55 million in 5 years. And recently, the new virus, H1N1, they gave the 1110 million funding. So we can notice China's really paying attention more, gave the big and huge funding to give that for the result. That is good news because they also to show the particularly the how to group, how to arrange the research. If later we can one-on-one to prove, to evaluate objectively for the TCM the work, they should be gave good contribution to our human being. That's it. Thank you.
Thank you so much, Dan Zheng. That was very clear. How encouraging to hear that TCM is getting that support. That's really good news. I remember Bizong telling me years ago of a Chinese proverb that says, if you need to call the doctor because you're ill, it's like having to dig a well because you're thirsty. And the danger is that the lure of the technology of Western medicine might drain the resources away from this other perspective of maintaining and safeguarding health. And so, of course, it's the human conceit that says, I've got the answer and I'm right and those people are wrong. And it happens so easily that we become triumphalist about our own discoveries. It's very good to hear that there's cooperation here, that Western medicine is integrating with traditional Chinese medicine in addressing problems like SARS. So thank you very much for that very helpful contribution. Let's thank her again.